Today is now July 8th, 2020. We'll deal with some situational things at the end, but for now, we now have 1,083 cases in Ingham County, 29 deaths, which is, I think, since middle of June has been steadily the number of deaths. We haven't had a new one reported in a while. We have one patient hospitalized in the ICU, 241 outpatient at home, 811 recovered with a 2.7% case fatality rate. We are currently monitoring 41 individuals ourselves and have completed 978. We do work with the state of Michigan with a team they call Salesforce. They're not selling anything. That's kind of an odd name, but anyway, they do a lot of contact tracing. So they are now monitoring 311 people and have completed 194. So the hospital graph basically is not very interesting. It's mostly green. We do have that one person in the ICU. So our hospitalization trends over the last several months have been nice and steady down here low. We had many days without any hospitalizations, many days with just one. So we definitely are holding our own with regard to hospital capacity. Again, these are only Ingham County residents. Keep in mind that there are possibly COVID patients at either one of our hospitals that might be residents of other counties, as well as McLaren Hospital has a contract with Michigan Department of Corrections. So some Michigan Department of Corrections COVID cases would end up at McLaren Greater Lansing. So we are basically 74.9% recovered, 0.3% home, and 2.7% deceased, less than 1% in the hospital. This is our graph of confirmed cases over time. You'll remember we were waiting for this plateau right here, which we had hit until a little bit mid to later June when we started a significant rise again. So that's kind of where we are right now. If you look at those, the incidences this way, by date of onset or date of referral if they're asymptomatic. So if we can't identify an onset of symptom date, it's date of referral. In other words, a positive test reported into our system. So that looks like this right now. As you can see, we saw another significant peak that was actually larger than our peak in April and May. However, it was shorter. So we peaked up and are heading back down rather quickly, which you would expect. I mean, the very reason for flattening the curve, having less people in the hospital, is that when we had these minor, or in some cases larger outbreak situations like this, that we did have the ability to test, case investigate, and contact trace, and do the isolation and quarantine that's necessary to quickly get things back under control in a community. So that is generally the work of an outbreak, is that we are able to get those things in control. Now, whether we're going to hold steady down here or not, again, as I told you back when we were in here, it's always hard to tell where you are in a curve when you are in the middle of the curve. So we're kind of back in that middle of the curve place. And, you know, as you can tell by this, we could easily spike back up, or we could kind of just, you know, bounce around and come back down. So we can't really answer that question very well right now, although we have a nice steady decline here from that peak we saw in mid to late June.
Excuse me, Linda, can you move a little bit closer to your mic? A few people are having a hard time hearing.
Okay.
Thank you.
Let me just move my computer a little closer. Is that better? I might need to adjust my mic on my, is that better? I'll just try to talk a little louder too.
You are louder.
I'll talk a little louder. Maybe I need to adjust my mic settings on this computer. Maybe they got off somehow or another. Anyway, so this is our percent positives per day. As I've been telling you for quite a while, when we have that uptick in cases, if we have a downward curve in positive tests, what it means is that we're testing more, not necessarily that we have more transmission in the community. So when we see this upward trail, as we did, coinciding with the curve, which I'll show you on the next graph, we know that that wasn't just a matter of increased testing, there was increased transmission in the community. So our 7-day rolling average curves now look like this, where you can see, that this peak that we had here in June is significantly higher than these peaks, although this one was kind of a double peak that we never got out of. And again, this one is coming back down. Don't really know yet what's happening here. But what we do know is this percent positive that did come up right with this peak is trending back down. So that is a good sign. I think that probably means a lot of people went out and got tested as a result of some of the outbreaks that we publicly announced, and those sorts of things. And so increased testing was happening. And so we have a little bit more cases than we had back here, but we're on a downward trend with positive cases, positive tests. By zip code, we now look like this. We talked about 48911 extensively. There have not been a lot of changes there, as our most recent outbreaks and numbers have not been impacting that area that we were tracking. So I'm not going to give you an update on those numbers. They would look very similar to what we looked at before. What we're now seeing is 48823. That is a result of the Harper's outbreak, that we have so many cases now in 48823. So that's what's going on with our zip codes. If you look at those by map, you see our highest case range at 48911, followed by East Lansing 48823, and then 48906 is this zip code out here in Lansing, and then this is, I believe, 48864 Mason. If you look at those by rate, because the populations in those zip codes are different, it turns out a little bit different still. Your highest range is your Lansing 48911, followed by East Lansing 48823. However, as you notice, the 48906 drops off to a lower range, and the Mason zip code is the one that, due to the population and number of cases, has a higher rate. We don't have rates for all of the zip codes, because for any zip code that we had less than 20 cases, calculating a rate is not very reliable. And so we don't calculate rates anymore if we have a zip code that doesn't have at least 20 cases. So we are only showing you zip codes in shading here if there are at least 20 cases in that zip code. We do a heat map, which looks like this. Usually I flip them around and give you the countywide bird's eye view first, but I was running a little late and didn't rearrange the slides. So this is a zoom in on the, kind of greater Lansing area, more with less of the out county in it. And you see, that cluster, that really tight cluster of cases in 48911. And then we do have a lot of cases in 48823, but you see all that pink shading and a little bit getting redder and a little bit yellow. They're just more dispersed. It is the countywide first. So this is the zoomed in one. You can see what I was just telling you, where we do have a couple of yellow spots here, but we just have a lot of really dispersed cases throughout the 48823 zip code. Our demographics by sex: 49% female, 51% male. If we look at our age range now, we've had a significant shift in age range, where we are now 30% of our cases in our 20 to 29 age group. And then our next highest is our 30 to 39 at 15%. So half what we have in our 20 to 29 age group. And then, 15, 12, 14 in those, 30 to 39 through the 50 to 59 age groups. So again, largely what we saw go on with our Harper's outbreak, as well as kind of what we're seeing as a trend in the state as well as nationwide. I think I saw a report from Arizona where something like maybe 80% of their new cases in the last week were in this 20 to 29 age group as well. And there was a 10-day period where about 70% of our new cases were in the 20 to 29 age group as we were dealing with the Harper's outbreak. So our confirmed cases by race are 55% Caucasian, 24% Black or African American, 12% Asian, 7% other, and 2% unknown. So when we look at that by prevalence rate, we see 275 for Caucasians, 790 for African Americans, 698 for the Asian population. So in both of our populations of color, a significant disparity in their prevalence rate or or the impact on that community compared to their overall representation of population within our community. If we look at cases by ethnicity, 84.7 are not Hispanic or Latino, 9.5% are Hispanic or Latino, and 5.8% unknown. So when we look at that by rate, we are slightly higher in our Hispanic or Latino population at 446.6 compared to our not Hispanic or Latino population at 340. When we look at our deaths by age, again, these slides are mostly the same because we haven't had a death in quite a while. So 13.8%, 50 to 59, 17.2%, 60 to 69, 27.6%, 70 to 79, and 41.4% of our deaths over the age of 80. Breakdown by sex, 48.3% of those are female, 51.7% are male. If we look at that by race, and this has changed because we updated some data from a death certificate. So we now, I think we used to have a other in here, and now that's an unknown, and one of our others became Caucasian. I just checked on that death certificate. So we are at 63.3% of our deaths are Caucasian, 30% African American, 6.7% unknown. By ethnicity, 86.2% not Hispanic or Latino, 6.9% Hispanic or Latino, and 6.9% unknown. And now we will talk about outbreaks. So there are a couple on here that we haven't been talking about, so I will talk to you about those a little bit. Harper's right now, we stand at 174 total cases. 33 of those are secondary cases. That is statewide now, and I believe 16 counties, last I looked. 88 of those primary cases are Ingham County residents, and 16 of them are secondary cases. So that's 104 cases of that total 174 that are Ingham County residents. You probably are aware of our rather small outbreak in the jail that got contained fairly quickly. That number was 9, is now 10. So we did get one additional case. That was quite a while ago. It's been contained fairly well. We don't expect to see a lot more going on here. We have what we would consider to be an outbreak anytime we get, this much of a population in a fairly small location at a Sprint store in Edgewood, where 3 individuals are ill, one of those an Ingham County resident. And then we've also been talking to you about the outbreak at the Riverfront Animal Hospital over from the 23rd until they closed on July 2nd were the exposure dates. So we now have a total of 15 individuals from that outbreak. 9 of those are Ingham County residents. 1 was hospitalized, but fortunately was released today. So that is where we are with that outbreak. Just a little bit in terms of situation. So I know that you realized that last week, or maybe the week before, the governor moved this region to the high risk level. There are risk levels that you can see on the My Start map, and that is different from the phases. We did not get changed in phases. So we did get moved to the highest risk level. And today she also moved the Grand Rapids region to the highest risk level and moved the Southeast region, which had been at medium risk, to medium high. And the rest of the state remains at medium risk. So that is kind of been confusing for a lot of folks because they first heard that and they said, is everything closing down? Did it change our phases? It's like, no, we kind of got 2 different things going on with these risk levels and these phases. So we'll try to help you understand that as we go along, but know that those are separate things. And I can stop there and take questions.
All right, if anyone has a question, feel free to go ahead. I don't have anyone in the queue right now.
And if anybody's in the queue, I fixed my microphone while we were doing that.
Oh, Kyle Kaminsky.
Yeah, Linda, are those the only 4 outbreaks that you're tracking at the moment then, or?
That is correct, yes.
Thank you.
The nursing home outbreaks that we were tracking before have all been closed. We go through 2 14-day incubation periods. And once we've cleared 2 14-day incubation periods with no new cases, then we close out that outbreak.
Very good. Steve Carmody, I don't know if that's a reaction or if you're raising your hand.
Raising my hand.
Very good. Go ahead.
Right. I was just wondering, the Harper's outbreak at this point, is it now on the decline as far as the impact of that event? Or is it too early to say that?
It does seem that we are declining in new cases. So we are definitely not adding a lot of new primary cases. And the last exposure date for a primary case would have been the 20th. So we need to go 14 days out from the 20th for the secondary cases. And so in general, I would say we are probably getting to a tapering period with secondary cases as well. I think we run into the occasional person that just waited forever to get tested, perhaps is asymptomatic, might have a minor symptom, and then sometimes people can test positive for a while after symptoms resolve. And so we do run into the just occasional secondary case, even though we're past that 14 days from the 20th at this point in time for secondary case incubation periods. So I would expect that number to start topping out anytime now. We tend to just add 1 or 2, 2 or 3 a day, when before we were just like, we could barely keep up.
Okay, go ahead, Ben.
So first of all, Linda, when you mentioned the moving of the regions, my audio cut out for a second. Could you just say again what you said? I'm sorry.
Yeah, I can actually show you as well. Let me pull up the MyStart map. So what happened was we got a lot of confusion because people didn't necessarily understand the difference between the phases. Like we're in phase 4 and the upper part of the state is in phase 5. And so we got moved to this high risk area in our region. And Grand Rapids also today, it was announced, got moved to high risk. The Southwest Michigan was in medium risk and has been moved today to medium high risk. And the rest of the state remains in medium risk. So you can see that the risk levels actually, are kind of get us confused with the phases. So though we're in a 2 risk level, we are still in phase 4. So the phases and these risk level indicators are different things. And you all can go to this MyStart map info, and you can come down here and look at things like this, test results, new cases. When you click on a region, it gives you the ones in that region. So this is, our region and where we're trending with positive tests and new cases. In terms of daily cases per million, we did at one point exceed 40 daily cases per million. So that has been trending down as well. So you can look at the data from any of the regions that way by just clicking on this map. So we can see what's going on over here in the Grand Rapids region, where they are now at more than 40 cases daily per million, which is a trigger point, as well as their increase in percent positive tests. So we still are down in a 2.2% positive test range. It was that daily cases per million that threw us into that high risk area.
So my question was, in regards to the Riverfront outbreak, the veterinary outbreak, and it's very early, but where could you see this being as big of an outbreak as Harper's?
I don't think so, because I mean, if you can imagine Harper's from June 12th to June 20th, right? Those were the dates. And they have a maximum capacity of 225. When they opened, they generally, pretty much late at night when college students are there, are pretty much packed. The line outside was evidence that they were at full capacity inside. And then they turn into kind of a turnstile where 5 people come out, 5 people can go in. And so on any given night, there would have been just hundreds of people there, well over 225 because of the turnover that happened. And that happened night after night after night. So this is a veterinary clinic. I would say that there are probably, I think there's 8 or 9 staff. And then there are, probably over that period of time of June 23rd through July 2nd when they closed, probably a whole lot fewer than that, well over 225 people every day going into that location.
And then what do you make of the large gatherings over the 4th of July weekend, particularly the one in the party in Cass County?
They terrify me, honestly. It is, I guess terrify is not really the good word. It concerns me. It's exhausting, to have made so much progress and then for people to just let down their guard so readily, especially after we saw some huge outbreaks associated with, large gathering kinds of parties, Harper's, the party over in Grosse Pointe Woods, those sorts of things, and kind of knew that these kinds of gatherings and this kind of just clustering together and hanging out, no mask, that sort of thing, didn't turn out well. And even outside, it does not turn out well. So certainly we'll be looking in the next, I would expect the average incubation period is about 5.5 days. So on average, if somebody was, doing that on the 4th of July, they might become symptomatic by about 5 days or so later. Let's give it 7. And then they probably, it's like, okay, now I got to go get tested. And then we got to wait for a test result to come in. So we probably will see those cases reported out more like in a 7 to 10 day or even a little longer period after the 4th of July. So there is the possibility that the 14-day incubation period can also be in play. But keep in mind that is rare and it is the far end of the incubation period. It keeps us in a nice safe zone for quarantine, but it really is unusual for somebody to go 14 days in an incubation period. It does happen, but it's not very common.
Thank you. Next week, Claire. Are we finished, Linda?
Yeah, I was just going to say, so that's what I would be looking for, 7 to 10 days after the 4th of July. So this weekend through the end of next week, the beginning of next week, we might see an uptick of cases across the state related to that. Because similar to Harper's, people traveled from all counties all over the place. It's not just the people in those counties. And so we could see an impact in multiple counties as a result of that.
Go ahead, please, Claire.
Hi, Linda. My major question, it has to do with the economy. Basically, with this upsurge in COVID cases and the increase in risk, what steps need to be taken in order to decrease this risk and open up business safely?
Well, in my opinion, for businesses to open safely, they should do what they are empowered to do in the executive order, which is when people leave their homes and go into public spaces, indoor public spaces, they are technically required to wear a mask. Now, there's no penalty if they don't, but a business explicitly in Executive Order 2020-110 can deny entry to anyone who is not wearing a mask unless they're medically unable to tolerate one. They can. In my opinion, they should. And that, in my opinion, is how we will get things down, keep things under control, and be able to keep things open. So I do think that a lot of this rests in the hands of the very businesses where some of these outbreaks are occurring. And that is, if we can enforce social distancing, which I know is not easy, in a bar that people are used to, crowding together in. The governor has closed down bars where over 70% or more of their gross sales in alcohol. So, you know, if people would wear masks and stay 6 feet apart, those things would be much less significant and much more manageable.
I just have one more question too. Basically, for your experience over these past few weeks, how do you think businesses have been complying to these ordinances, or just like trying to make people wear masks in the businesses? What's your general experience this whole time?
My general experience is it's a real mixed bag. There are places that are enforcing it exclusively. It's like they don't let people in without a mask. If you come to their store and you don't have a mask, they will offer to go inside and get whatever it is that you need, get your list, whatever, and bring it back out to you. And they just simply don't let people in without masks. Then you have places where there's just like no adherence to any kind of masks. And then you run the gamut of everything in between. You know, trying to throw a number on average of what that is at this point, I don't know. But again, the extent to which our businesses can unify and say we are going to deny entry without masks is going to be very critical in keeping this under control right now and getting us through the fall without having significant impact from the second wave.
Thank you.
Mm-hmm.
Go ahead, Robin Erb.
Hello. Thanks for doing this today. So with some of these recent outbreaks, it just occurs to me the complicated nature of contact tracing. And we've talked a little bit about this, you know, strangers being with strangers and whatnot. I'm just wondering what the experience has been with your contact tracers, whether it's Harper's, whether it's Riverfront, whether it's some of the other, you know, some of the other cases. Have people been pretty cooperative, or?
So here are some of the challenges that we experience. One is people not answering the phone when we call. Now, that just happens. So we're trying to, we may have resolved that today. You know, when you get a call from a number you don't know, when you get a call from something unknown, if it's coming in as unknown, most people have a tendency not to answer. I'm a health officer. An emergency could get called into me anytime from any number. I always answer my phone. But that's because I know that I can get calls from unknown numbers and they're urgent and important calls. So right now, you know, answer your phone. If it's a spam call, just hang back up on it. But it could be the health department calling. We are working with our phone cell service provider and getting our outgoing caller ID to say Ingham County Health Department. They said we were the first place that it asked, so we're working on that right now. As of today, I thought that was supposed to have been resolved, but I haven't checked with our staff to make sure. So that call now should come in saying Ingham County Health Department. The other problem we run into is when we make that call, if we don't get an answer, we sometimes encounter full voicemail boxes. That's more common, apparently, from what I'm hearing from my staff with the youth. So when we had the Harper's outbreak, there was a lot of no answers, or some no answers, and then also full voicemail boxes. So try to make sure your voicemail box isn't full. We will never leave a text message for someone on our initial contact with them, because we have to make sure that we have the right number and that we're talking to the right person before we divulge any kind of any information. So we will leave a voicemail message saying, you know, this is the health department. We need to talk to you, please call back, kind of thing. But we would never just text. So once we are in contact with somebody, then the ongoing, you know, case investigation and checking on people, that active monitoring and all of that, sometimes we can do that via text message. So that's one of the problems we encounter. Occasionally we run into people who do not want to tell us the names of their contacts. And so they just don't share. Now that doesn't happen very often, but it does happen. And then the third thing really is when you get into these situations where you've had a broader public exposure and nobody can even tell you, you know, the people that they were in Harper's Bar or were in, you know, Riverside Animal Hospital, the veterinarian there just seemed to think it was going to be about impossible to give us a list. And so we did a public notification in order to make sure that everybody knew and that word got spread around. So that is the other thing, is just those unknown people. And then there's the public notification, the outbreaks in the jail, the outbreak at the Sprint store that I was talking about, those we've all been able to contact trace, case investigate, get a hold of contacts, that sort of thing. So we haven't had to do public notification, but these two that we did public notification were just because of that very thing. It was just impossible to get a hold of anybody who potentially was exposed, or everybody, who was potentially exposed.
So when you do get somebody on the phone, generally they're pretty cooperative then.
Generally so, yes. Yeah.
Go ahead, Dave.
Hi, Linda. Do you ever look at some of these, as a health official, some of the maps that are put out in between the phase map for reopening, the county health department region map, and then these high risk maps? And then it starts to get, for media, let alone general public, at times confusing as hell, trying to differentiate.
Yeah, yes, I will say that it can be very confusing. As a public health official, I eventually can dissect it out and discern it and understand, oh, that's what they mean, and that's why this is this way. But for the average public to basically consume it that way, I think is kind of challenging. So, and when we're trying to put information out to the public, which we're doing, because that My Safe Start map has a private side to it that I can get access to that has even more data in it. The one that you have access to has a little bit of data in it. Mine has more. I showed it to you once. So we do put it out for the public to see. And we put the other maps out for the public to see. And we put our dashboards out for the public to see. And when it is, even in my opinion, challenging to say, okay, well, what does all this mean? And with the expertise that I have, eventually figure it out and be able to explain it to you. If we're putting it out publicly, we shouldn't have to do a lot of explaining. So I hear your pain. I feel your pain.
Okay, thanks.
This time we have no questions in the queue. If you have a question for Linda, please go ahead. Ben, go ahead.
Linda, within the past hour, Governor Whitmer has set a news conference for tomorrow morning. It's unknown at this time what she's going to announce, but she has said in the past that if we see a sustained spike in cases, that she would dial back. Is there anything that you would want her to do tomorrow morning?
I'm just going to have to say it. What I would want her to do is reconsider the executive order that she issued last week about bars and restaurants. Now, on the one hand, the intent of that order is good. On the other hand, the enforceability of that order is challenging for all of my local health official colleagues and myself. So if you read the executive order, this whole 70% of gross sales is, the establishment they have to look at their last year's sales and determine that, or they have to look at their 2020 sales to date. So does that mean we're leaving it up to them? I don't have that list. I don't have that information. I've talked to the Liquor Commission. I've talked to the Michigan Licensed Beverage Association. I fully support everything that the governor's doing. She's doing a great job. But that particular order has been challenging to figure out how to enforce. So when I don't know, out of the 1,000 licensed food facilities in my county, because we don't license them separately here. We don't have places licensed as bars or nightclub and other places licensed as restaurants. They're all licensed the same. So I know a few places that serve only alcohol. That's clear. I know of a strip club in town. That's clear. Then you get into, there's a whole bunch of places that serve no alcohol. So that's clear. And in between, there's a whole bunch of in between that it's like, I don't even know. And quite honestly, if you look at the menu from Harper's Restaurant and Brew Pub, let's give that as an example. They have a fairly extensive menu. Most bars, restaurants that have 70% or more of their sales in alcohol have a very limited menu because they keep fairly limited ingredients on hand to be able to serve you what you ask for. When you have a fairly extensive menu, you have to keep a lot on hand in order to serve people what's on this fairly extensive menu. And if you're not selling food at that kind of level, then you'd be throwing it away a lot. So I haven't checked yet because they're closed, but I'm not sure that Harper's would have even fallen into the 70% or more gross sales in alcohol, which means we have a very clear example of a bar that became a very big problem, and I'm not sure that that order would have closed them down if they weren't already closed down. So I think we need to look at that and think of ways or other things that can be done that get at the kind of activity that we're talking about, which tends to be late at night, loud music, nightclub kind of activity, which can happen in a lot of establishments that are restaurants as well, because at noontime people go in to eat, at dinner time people go in to eat, they're different age groups, and then 9:30, 10 o'clock at night, it turns into a completely different atmosphere. But that doesn't necessarily push them to 70% more of gross sales in alcohol over the entirety of their business. While it might be between those, hours late at night, it is not necessarily during the day, and then those things balance each other out. So, I would have a number of suggestions as to how we might change that order a little bit in order to really effectively get at the establishments that we need to get at. We've got some of these distillery places which don't tend to be nightclubs, and they got impacted by that, but you're not going to see the kind of activity that you see at a nightclub, someplace like that. So, there's just got to be, to me, I would tweak that one a little bit. And at the same time, fully supportive of what the intent was behind that. I just have no idea the establishments in my community that have 70% alcohol sales or more. And so far, I haven't found anybody that can give me that information. And I don't have the time to turn it into a large research project for my staff to go out and check everybody's sales.